charity donation, and once that is confirmed, before you ship the goods, you are given the go-ahead. Yeah? I really find it very, very unfair that people out here in the diaspora with serious connections find very useful donations that our country cannot afford, and they want to send them home to help the people they left behind. And government has made it almost impossible. It's really very, very unfair. And it's really lack of empathy. It's lack of humanity. You know, even as we run government, of course the government is not a human being. It has no feelings. It's an abstract thing. You cannot pinch it, it cannot feel pain. But within government there are people. People should be able to have empathy, should be able to behave like human beings. In our manifesto, we're gonna include that we are going to create a body that will be receiving proposals of people out here who have certain goods that they want to bring to help home, not to make profit, not to sell, and do the inspection. The purpose of that committee is also to avoid people taking advantage. You know, because Kenyans are also crooked, you know that. Our people are also not very straight. They may also want to use that to bring goods without paying. So there must be a connection. There must be a connection where you will declare the goods, where they are coming from. Then the institution that is receiving them is inspected, and then they sign a certificate that they will receive those goods, and the goods will be in use. And then they will give what you call an indemnity, that in case an inspection is done and it is found those goods were not received, they will be able to pay the duty that is equivalent. So there must be a way working around it. Yeah. And in fact, we were discussing it with Reverend Dorcas last night, because we also have people we have visited and they want to help, and it's difficult. And I think that is one commitment I want to give, and I want you to hold me to account, Elizabeth. Yeah? Next year in December, if it doesn't happen, yeah, I have a farm in Shamata, you can walk there and look for me. So that as we wewe kiongozi ulikuja ukatuambia mlichaguliwa mwezi ya 8, sasa ni December, wapi ile maneno ulituambia? I want to be held to account. One last one. Another lady, the men were too many. We have to be gender sensitive.
Thank you very much, Your Excellency and Ms. Dorcas. Thank you very much. My name is Bridget Mange. Bridget Mange from Kiambu, a health professional in this country. Reason I'm standing is to raise issue of concern about our health in Kenya. People are dying because of cancer and people cannot meet the bills. What do we have in place that will stop corruption in the hospitals to help people who are suffering to get the right service?
On another issue, I'm a mental health clinician, and I would want to know, what are we doing? You have talked about depression, alcoholism, time and again, and you have mentioned of suicide deaths that we are experiencing on a daily basis. I raise mental health awareness in Kenya because of the passion, and I do it here within our community. I met Mama Boyce when she had an event at Oresereni. We didn't talk much, but it was all about saving the boy child. What are you planning to bring in place? We have professionals here who are willing to come and volunteer. But again, there are areas that are made so hard for us to come and volunteer. I do it, it's a volunteer thing, and would like to get a place where we'll be able to support people the best way possible. Thank you very much.
Thank you very much, ma'am. It's true, the disease of cancer is ravaging homes, leaving homes in destitute. Homes that were once standing are left without anything, and the patient dies. Every weekend we have harambis to raise money for cancer. And cancer is a very expensive disease. And I've personally gone through it. My late brother died here in 2017 because of pancreatic cancer. And I was here for almost 2 years, and we spent millions of shillings, but we didn't save him. Now, cancer was isolated cases here and there. And that is why it was having stigma then. It doesn't have any stigma anymore. It's a way of life. Homes are devastated. When we took government, we had made a promise that we will reform NHIF to be available to all Kenyans and take care of chronic illnesses. Because again of corruption, conflict of interest and state capture, we needed 800 million Kenya shillings to reform NHIF to make it compatible with modern times. But Ruto decided he needed to make money, did away with NHIF, and brought a monster called SHA at a cost of 104 billion Kenya shillings. We have checked, the system cannot cost more than 1 billion Kenya shillings. So they have stolen 103 billion Kenya shillings. And SHA is not working. All those patients suffering from cancer and other chronic illnesses are on their own. We intend to go back to factory settings, find out where we left NHIF, reform it properly, have people like yourselves who have health insurance schemes that are working. You come and tell us how it is done, because it's working elsewhere in the world. There's no reason why it shouldn't work in Kenya. So that is something we intend to do, and I can tell you the Kenyan people are crying. One of the reasons why William Ruto is in trouble with the people of Kenya is a failed health system. People don't want to see him. Him and Duale keep on saying SHA is working. People just stare at him and wonder which country he's talking about. We are having a serious problem with our health system, and more so insurance for health purposes. So that is something that I think we must work on, because health is a priority for any country, for any nation. For a country to prosper, you need a healthy nation. So I want to give you my commitment that we are on it, and we'll borrow insights from people who have seen it happen like yourselves to make it work. We have serious challenges, the way you have said, on mental health, matters depression, drug addiction. I tried to do a lot with the Mama Boys when I was in office. At least I was able, to a great extent, to deal with illicit brews, and was 80% successful. You know, people had become sober, and young people had started having families. And I was dealing with prevention. Reverend Dorcas was dealing with addiction, people who are beyond prevention. She had several programs, and she helped many young boys. Unfortunately, when we left office, this alcohol was allowed to come back. The president appointed 2 drug barons into the cabinet, you know them. One from Kiambu, the other one from Coast, you know them. I don't need to tell you their names. These are drug barons. They sit in cabinet where our government is supposed to deal with the drug abuse, but 2 ministers deal with the drugs. I'm told even one of them is campaigning to be deputy president. So you can imagine a president who is a thief and a deputy who is a drug baron. What kind of country we would have? So we have a serious problem, but again, we need political goodwill. I foresee a situation where once we form government, we'll discuss with the county governments so that in every level 4 hospital in the country, there is a ward dedicated to rehabilitation of people who are addicted to drugs. You know, border accidents. We are saying border accidents. We are saying even now, people addicted to drugs is a serious problem. So we should have a ward. I agree with you, it's something we need to think through with my team, with help from the diaspora people. How do we create a mechanism in our country where people who are experienced in the health sector can come and give services when they come home and transfer knowledge and technology to our people? It's something we need to think through, but I think it's a good thing. I think it's doable, where we can create an exchange program that we have our registered health workers across the world, and we are saying when they come home, they inform the government in advance. They give a choice of where they would like to work near home. If you are from Kiambu, you work there at Kiambu Level 5 Hospital. Come and give a contribution to home where you come from. I think it's food for thought. There is need to work on that one. We create that framework and that mechanism because I think it's a good thing and I think it's doable. So, asanteni sana. Thank you very much. Asante.
I just want to say a huge thank you to Your Excellency just for engaging with us very openly, transparently, and making a lot of promises and commitments to us. I'm sure we can all agree that we feel seen, we feel heard, and we feel acknowledged as diasporans. Thank you so much for your time. We appreciate it.
Asante sana. Nimeona mlikuwa na maswali mengi, si ndivyo? Lakini silitarudi. Sasa nikijibu yote, next time nitajibu gani? Si tuende pole pole. So at least we have answered those ones. When we come next time, I'm telling you, I've left here a better person. This listening to people is everything about leadership. How will you know these things unless you listen to people? You sit here in those big offices going around with the chairs, the red carpet, nini na watu wamekuzunguka wanakudanganya, oh king, you are the best, oh nini, people love you, people are very happy, na ni uongo. But I think when now the issues you have raised here, like that issue of equipment and items for charity and the way to deal with it so that people can be able to harness resources for charitable work is an important thing. That issue of mental health. These are great ideas and I'm very grateful to those who have contributed. I want to say thank you. I've left here a better person than when I came. And what you have told me, what I have learned, will inform my leadership and it will make me a better leader. And I think you'll be very happy one day when you hear a policy pronouncement has an answer to what you raised. You feel very happy. You feel very happy. And we'll do it, by the way. This public participation cannot be an exercise in futility. We cannot just be discussing here for the purposes of discussing. Something must come out of it. So once we get the opportunity to run government, most of these things we have discussed here, we'll agree with you and you see it happen. And you will be very pleased that you had the opportunity to raise those issues. Asanteni sana, Mungu awabariki, and thank you.
Can we all stand up and give His Excellency a clap offering? Thank you so much, Your Excellency, for your wonderful speech and answering of the questions. Now we're going to turn attention to Zangi. He's going to give us 1 or 2 numbers to warm up as we near towards the close. Thank you so much, Zangi. Take the space. Thank you. Excuse me, before Zangi starts, we have a few cars that need to be moved. I think some people are blocking others.